respect, your opinion, and we are grateful that you feel, comfortable to express it, and we certainly will, be respectful and appreciate it. Delegate Shalega.
Thank you, Madam Chair. And like Delegate Morgan, this is not personal to the advocates that are here today to watch our voting session and my colleagues. This is not personal. It is medical. And I went back and listened to the hearing, and it was said over and over and over, this isn't for minors. So it is for, I'd like clarification on that, because I read the bill, it is for minors. So what can you tell us?
Okay. Thank you. And I know Delegate Collison is she's taking notes, and she's going to be addressing all your points. So anything else, any other questions you may have?
Back and forth with this?
Yeah, it is. I just wanted to make sure to allow them. They didn't really have a question. They were giving us their view. Okay, so that's why we haven't had back and forward.
Okay, I'm ready for back and forward. All right. Not my view.
All right. So now you're going to get your answer. Right?
I have a few other questions, but if we're gonna if this is the way,
No, you have. Delegate Shalega, Delegate Hutchinson didn't have a question.
Right, no.
Delegate Morgan didn't have a question. Delegate Chisholm didn't have a question. You have a question, and I just asked Delegate Collison, would she address it? So just give us a minute.
Yeah, it's fine.
Okay. Thank
I'm
you.
Not
and if you have the rest of them, let her answer that one, and then you can give her the next one, okay?
Okay.
All right. Delegate Collison, please.
Thank you, Madam Chair. And I do want to thank everyone who's expressed their concerns and feelings about this bill. And it's very important for us to have these kinds of conversations. So the issue of minors, this bill does not change current practice. What is happening right now in Maryland is going to continue under this bill, which means that puberty blockers will be used on adolescents. And again, I need to be very clear under the conditions that these are used. It has to be with the child expressing their concern and demonstration of the gender dysphoria as defined by a physician and a mental health provider. So it's not just a 6-year-old boy saying, I feel like a girl. It's a 6-year-old boy who says, I feel like a girl, I don't know what to do. And the parents taking this child to the appropriate medical providers to have that child assessed in terms of the potential for gender dysphoria. The early part of treatment for younger children is essentially counseling, and lots of counseling, and also some social acclimation and socialization, because these are children who sometimes suffer a lot of bullying. We heard about that this morning, and so they need to know that they are accepted, and that's the early part of the treatment for when children begin to identify that they're having concerns. But puberty takes you into another realm, right? That's where the body begins to manifest the physical elements of the biological gender. So if the child is experiencing dysphoria and their body starts to change in the way that takes them further into the biological sex that they don't feel right in, then that is what causes the even greater emotional distress. Puberty begins at different times for different children. Again, these young people are under the care of a physician, and parents are involved at every step of the way. And it's over time. Nothing will happen in a short period of time. And, puberty blockers have been used for almost 50 years. We have a tremendous amount of experience with puberty blockers. There may be individual cases, as there are with any kind of medication, but in general, tens of thousands of people who have been on puberty blockers have been studied, and it has only helped them work their way through to becoming the fully actualized person that they can be. And the evidence, and there are several recent peer-reviewed studies that say adolescents who have access to puberty blockers are much more stable in their mental health than those who don't. And those who don't who don't have access to these puberty blockers at the appropriate time, those are the ones who are at higher risk for suicide. All of the data that we have says once you take them off the puberty blocker, the body begins, if everything else stays the same, the body begins to initiate puberty. I think it's the pituitary gland that kicks in and begins to change the body in ways that manifest for the biological sex. In terms of surgery.
Can I respond to that?
Sure.
The puberty blocker, thank
Okay.
you. So we must be reading different medical information. I have a stack of it right here in front of me. I've done my homework. I think you know I do my homework. And I will tell you that is not what the medical research shows. I can read you a list of things that puberty blockers do. They risk infertility by blocking the maturation of sperm and eggs. Puberty blockers compromise bone mineral density. I've seen this in many, many studies about bone density by giving puberty blockers to adolescents. They hinder brain development and compromise sexual function. The U.S. FDA added a warning for a pseudotumor cerebri, which Dr. Hill could probably pronounce better than me, July of 2022. So less than a year ago, there is a study that is showing serious health effects. They are not proven fully reversible, and long-term complications are known. After cross-sex hormones, estrogen used in male biology strongly increases the risk of blood clots and heart attacks, strokes, breast cancer, insulin resistance, and more. I have a whole list of things, and this is from a medical study. I'm not making it up. I didn't get it on People magazine. I mean, these are real science data. So I hope that, you know, I understand that you're presenting the facts as you know it, but I've talked to numerous doctors, and that is not what the science is showing. In Britain, they closed their clinic. Did you read that? Did you know that? Great Britain had a clinic where they were doing a lot of these treatments, and they closed it because of the health risk to kids.
All right, let me allow her to address that, okay?
Thank you.
Delegate Collison.
So virtually every medical profession in our country supports the use of puberty blockers. I don't believe that our practitioners, as a group, as organized groups, would be advocating for medication that would be harmful. As I said, I think there may be instances with individuals who have reactions to medication, but in general, they've been used for 50 years. If we had seen the kinds of repercussions that your studies are addressing, and I'd like to see them, then I can't imagine that we would continue to use them in this country.
Well, it is from the American College of Pediatricians. So what I just read you is from a national, reputable, recognized organization of pediatricians. So, you can't say all the medical data says, because that's not true.
No, what I'm saying that is most of the the medical organizations of practitioners
Well,
are.
some, maybe
Right.
not most. but-
Okay. I wanted to address the age restriction issue that Delegate Hutchinson raised. Most of the commercial insurance companies require the person to be 18. The only time for surgery, any kind of surgery, the only time there's an exception to that is when there is a clear and present danger to the young person because of their dysphoria. In what I've heard from some of the physicians is that happens after a suicide attempt. But again, I'm going to say no surgery would happen in less than a year's time. The requirement is there's intense psychological support, there's parent support, there's the young person who is in distress and asking for this, and they have to live for a year in the gender that they see themselves as, that they understand themselves to be, before surgery will be considered. So the occurrences of surgery under the age of 18, the statistics are, it's like way less than 1%, way less than 0.1%, because it's a few individuals who are experiencing such distress that the only way to make sure that that young person stays alive is to allow them to become the person that they know they are. In terms, and Delegate Morgan, you made that comment that gender dysphoria is a mental illness, and indeed, that's what it is defined as. However, the thing that's causing the mental illness is the fact that their understanding, their knowledge of who they are does not match their biological sex. And it is, it's almost incomprehensible to us who haven't experienced it, but we know, all of us know people now who have been down this path and can explain that, that dysphoria can be addressed with the appropriate treatments. And, I need to say too, not every person with gender dysphoria decides to go through every single treatment. They make their own personal decisions about what's best for them. And what we're trying to do is say, we want to make sure that those who are financially not struggling or challenged are not relegated to not being able to become who they know they are, and who experience self-loathing, who experience incredible harassment, abuse, and frankly, more transgender people are murdered proportionally in this country than other groups of other classes of people, because of they're not socialized, because they're not living the life that they know they are. And I have one other comment, and then I'll stop talking. And Delegate Morgan, you mentioned what's happening. Why is this expanding? Why are there so many more now in each succeeding generation? And I truly believe that it has to do with greater acceptance, and not just greater acceptance, but the desire to self-actualize. People are getting their voices and are saying, I need to be seen for whom I am. And that is throughout our culture, and virtually every kind of different person is gaining that voice. So, again, I have to go back to, I wouldn't choose to be someone who would be subject to abuse and discrimination. So these folks are not choosing this. This is who they are, and we can help them. We can help them stay alive by making sure that the medical care they need to self-actualize is available to them. So with that, Madam Chair, I'll stop for now.
1 second, may I just continue with Delegate Shalega and then come back, please? Thank you so much. Delegate Shalega.
Thank you. So back to the youth, and we've had quite a bit of discussion about when youth's brains mature, and a bill to not charge people under 25 with a crime, and so many of us are very concerned about the youths, and hence my questions about puberty blockers. And in the bill, I see that the standard of care that this bill, which means the law going forward, is going to be WPATH. And under WPATH, their ages that they had reported for treatments: 14 for cross-sex hormones, 15 for removal of breasts, 17 for removal of testicles. And I think that castrating children is wrong. And if we adopt this bill under these standards of WPATH, we are opening the door to castrating and mutilating the bodies of children. And yes, I'm heartbroken for their mental health. I am. And the other data that I have here shows what Delegate Morgan said. It's a well-known study. 85% of the children that are having gender dysphoria, gender questioning, 85% of them return to the gender they were born with, and they do not commit suicide. And if they get the right mental health treatment, that's what we should do. All of us are for that. But allowing, especially stories in divorced couples where one parent is allowing their child to be disfigured and the other parent isn't. That these are well-known court cases that you can find. And I think it's very irresponsible of us to not put an age limit on this and say no one under 18 can alter the genitals and gonads. That they should not be getting their breasts removed, their testicles removed. It's a step too far. And not recognizing that these other treatments have very, very serious lifelong complications is irresponsible as well.